Hi guys, hope you're well. I want to do a really quick video on something that I get asked quite a lot at our courses. What happens if we forget something really big in the first half or data gathering and we think about it halfway through examination, or we think about it halfway through our management plan, or we think about it with 1 minute to go over the case? What do we do? Do we miss it out or do we ask it at that point? Now, the first thing I would say is these aren't tests of memory. It's not that you have to remember everything in the first half, and if you miss it in the first half, you're going to get penalized for being asked in the second half, or you'll lose structure, or you'll lose marks for being disorganized, or just being doctor-centered. Look, this is not the case. Firstly, okay, we're human beings. We are going to forget things, especially when you're stressed in exams like the ones that you're preparing for. You're going to forget the odd thing. Of course, we talk about how to try and minimize that and make sure that doesn't happen again and again and again. But the odd time it's going to happen. Say, for example, someone comes in with vomiting and you've done your data gathering and you examine the patient and you're into your second half and you realize that, I didn't ask about vomiting blood. Now, a lot of people will tell you, don't ask about that in the second half because you'll lose marks for structure, it looks disorganized, etc., 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 and it just frightens people, so they don't do it. Now, what if that person did actually vomit blood? That would change the whole game. Now, you've thought about it, you've done the hard work, you remembered it, but you've decided actively not to ask it because it might look a little bit odd and a bit doctor-centered. No, ask the question. Just be really genuine in the way that you ask the question. Mrs. Actually not, sorry, I should have asked you this earlier on actually, but you mentioned this vomiting. Can I just check there's not been any blood in there, has there? Now, if they say no, fantastic. You let it go. Oh, thanks for clarifying that, and you move on. No damage is done. If they say yes, well, actually, doctor, a couple of times there was, that completely changes the game. And thankfully, you've got it now, and it's not come out with 30 seconds to go, or worse still, it doesn't come out at all. And later on you think, I should have just asked about blood. Please ask, just do it in a natural way. Say, for example, you're doing a consultation and you're getting a few hints near the end of that consultation that this person's work is really impacted. And you realize, I haven't actually asked about work. I don't actually know what this person does, and I should have asked about it earlier, but I can't ask about it now because it's going to look really odd. Please, please, please go and ask about work at that point, because it can completely change what you can do in that remaining 30, 40, 60 seconds. Mr. X, sorry, I should have asked this earlier on actually, but I'm just wondering, how's it impacting you at work? What do you do for a job? Oh, doctor, I work in a factory and it's really impacting what I can do. My boss is getting really annoyed. Bingo, that's a really, really important part of that case. Now, because you've just been genuine about it, at least you've got it out at a point where you can do something about it. You're not going to lose structure marks there. You're not going to lose organization marks there because you're a human being and you've just been honest about how you perhaps should have asked this earlier, but you're double checking it now. That's what a safe doctor does. If you forget something in the first half and you think about it in the second half, whether it be red flags or key medical questions, a safe doctor will double check that they've not missed it. A safe doctor will not think, I should have asked that early on, but because I've now gone into the second half of the consultation, I don't want to look like I'm disorganized, poorly structured, too doctor-centered. Be genuine. Like with most things, it's not what you do in these scenarios that count. It's how you do it and how genuine you come across. I really, really hope this helps. We covered this and so many more of these typical type of myths and queries that people have in these types of exams at our Immersion CSA courses, our Immersion PLAB 2 courses, and our Immersion GP Stage 3 course. Have a look at the website, auromedicaleducation.co.uk, and book yourself on one of these courses. Hope to see you soon. #CanPassWillPass. #I went with Arora.